Hello everyone, welcome to the channel. I am Dr. Saroj and today we are diving into a topic that's very common but often misunderstood when it comes to child health. Earwax in children. Have you noticed your child tugging at their ears or complaining of discomfort and wondered if it's just earwax buildup? While earwax is a natural and helpful substance, sometimes it can become a problem, and as parents, it is a little tricky to figure out what to do. Well, stick around because in this video, I will take you through everything you need to know about earwax, from what it is, how to treat it, and some common mistakes to avoid. So let's get started. Let's start with the basics first. What exactly is earwax, or cerumen as we call it in medical terms? Earwax is a natural substance produced by glands in the ear canal and has a few important functions. It helps to trap dust, dirt, microbes, and even insects, preventing them from entering the delicate inner parts of the ear. It also has antibacterial and antifungal properties. And believe it or not, it protects your child eardrum from getting injured as well. Now you might be wondering, what exactly is earwax made up of? So basically, it consists of fatty acids, cholesterol, dead skin cells, hairs, sweat and serum produced by the glands in the ear canal, and water. Although earwax is important, if it builds up too much, it can lead to problems, especially in children. But how often does earwax buildup happen? Well, studies suggest that earwax buildup in children is pretty common. And in fact, about 10 to 15% of the children experience excessive earwax buildup at some point. It's quite a lot when you think about it. In fact, earwax buildup is one of the top reasons children visit pediatrician for ear-related issues. It is also important to know younger children, especially those under the age of 5 years, are more likely to have problems with earwax because their ear canals are smaller and more prone to blockage. So now the question is, why does earwax build up in the first place? Well, here are some common causes. Number 1, overproduction of wax. Some children just produce more wax than others. This could be genetic and there's nothing wrong with it. Number 2, cotton swabs or other objects. Yes, this is the big one because using cotton swabs to clean the ear can push the wax deeper into the ear canal instead of removing it. This is a very common mistake that parents make, and it accounts for nearly 70% of the cases of earwax infection in children. Number 3, narrow ear canals. Some children naturally have narrow and curved ear canals, which means that earwax has a harder time working its way out. Number 4, frequent exposure to water. Swimmers or kids who bathe regularly often experience waterlogged earwax, which can lead to buildup as it becomes soft and clumped. And number 5, ear infections. Sometimes infection or other conditions like eczema can contribute to excess earwax or even ear discharge production. But how can you know if your child earwax has become a problem? There are some telltale signs to look out for, like if your child is tugging at their ears or complaining of pains, if they have difficulty in hearing or a sense of fullness in their ear. It can also be associated with itching inside the ear and tinnitus, which is a ringing or buzzing sound in the ear. And if the earwax has been stuck for a while, it can cause some fluid or even pus to drain from the ear, possibly with a fall odor. So how does your pediatrician figure out if earwax is an issue? It's actually pretty straightforward. Simple physical examination with an otoscope, which is a lighted device that looks inside the ear, is used to detect for blockages. In most cases, that's all that's needed to diagnose. But if the ear canal is severely blocked and there are some concerns about hearing, an audiogram, which is a hearing test, might be recommended. Now, before talking about the common mistakes that parents usually make, let's talk about the treatment options. There are several ways to treat earwax buildup depending on the severity of the situation. The most common approaches include: number 1, ear drops. The first line of treatment is often earwax softening drops. These over-the-counter drops help soften and break down the wax, making it easier for the body to clear it naturally. However, it is important to follow the instructions carefully and avoid using them if your child has an ear infection or a hole in their eardrum. Number 2, ear irrigation. For more stubborn wax, ear irrigation might be helpful, which involves flushing the ear with warm water to help remove the wax. I would recommend you to try this at home though, because it's better done by a healthcare professional to ensure it's done safely. Number 3, manual removal by professionals. If the wax is very impacted, a pediatrician or ENT specialist might need to use specialized instruments to carefully remove the wax. It's generally safe and quick, and it's the best option if you are not able to clear the wax on your own. Number 4. Microsuctions. In some cases, microsuction, which is a process where a small vacuum is used to suck out the wax, may be recommended, especially if the wax is deeply impacted. But remember, this should be done by trained professionals only, and please do not try this at home. Now let's talk about the most awaited topic of this video. Common mistakes parents make when trying to remove the earwax at home. I see this a lot of time in my practice, and it's important to avoid these mistakes for your child's safety. Number 1. Using cotton swabs. Don't do it. As tempting as it might be to clean your child's ear with cotton swab, this is one of the worst things you can do. Cotton swabs can push the wax deeper into the ear, causing even more of a blockage, and you might also risk injuring the delicate skin in the ear canal or even damaging the eardrums. Number 2. Inserting objects into the ear. Never use hairpins, pens, matchsticks, or other sharp objects to remove earwax. This can cause serious injury to the ear and lead to infection or even perforation of the eardrum. Number 3. Ignoring the symptoms. If your child is complaining of ear pain, discomfort, or hearing loss, don't just assume it's something minor. It's always best to consult a healthcare professional to rule out any other serious underlying issues. Number 4. Using unapproved ear drops. Not all ear drops are safe for your children, so please make sure you check with your pediatrician or ENT specialist before using anything at home. So now let's talk about what happens if you don't treat it. If left untreated, earwax buildup can lead to several complications like conductive hearing loss, ear infections like otitis externa, persistent tinnitus, which is a ringing or buzzing sound in the ear, and in severe cases, eardrum injury leading to further complications affecting your child's health. So to sum it up, earwax in children is very common and usually is not a cause of concern, but it should be managed properly. Don't try to clean ear with cotton swab or sharp objects. And if your child is experiencing pain or discomfort, make sure to consult with a healthcare professional. Treatment options like ear drops, ear irrigation, or professional ear cleaning can help, but always follow the right procedures under guidance. If you found this video useful, please hit that like button, subscribe this channel, and share this video with other parents as well. And please feel free to leave any questions or comments below in the comment section. I will see you in the next video. Thank you.